Services. As always, I will start by sharing our current data. Just trying to, between all my different screens, trying to make sure that I've got the correct screen up for you. So fortunately, since last week, we've added one person, only one person, who has tested positive in the last week, bringing the total to 611 people who have tested positive. If you add up the individual months, you'll see that the total number of diagnoses per over the 2-year period almost it equals 629 because we've had 18 people who have tested positive twice. 8 of these had a second diagnosis in December, 8 had a second diagnosis in January, and 2 who were previously diagnosed 2 times. The one that we added this week was a person in supported living. And so by placement type, we've had one person in a correctional facility, one person in 14 people in host homes, 126 people in intermediate care facilities, 1 in a mental health facility, 115 in natural homes, 2 people in a nursing home, 6 in out-of-state placements, 50 in residential habilitation, and 296 in supported living. So the 126 folks in ICFs who contracted COVID account for about 42% of people in ICFs who have contracted COVID. Among these 126 people, we've had 28 deaths. However, only 13 of those deaths are confirmed as COVID deaths, working out to about 10% of people in ICFs who contracted COVID and subsequently have a confirmed COVID death. In natural homes, it works out to about 12.5% of people in natural homes who have contracted COVID. Of these, we've had 6 deaths, but only 5 are confirmed as COVID deaths, being a little over 4% of people in natural homes who contracted COVID and have a confirmed COVID death. In residential habilitation, 50 people who've contracted COVID constitute about 46% of the people in residential habilitation who have contracted COVID. Among these people, 3 have died, but only 2 are confirmed COVID deaths. So about 4% of people in residential habilitation who contracted COVID have a confirmed COVID death. In supported living, 296 people account for a little over 30% of people in supported living. Among those, there were 27 deaths, but only 15 are confirmed as COVID deaths. So that works out to about 5% of people in supported living who contracted COVID and subsequently have a confirmed COVID death. Overall, of the people supported by DDA, 611 people account for about 25% of people supported by DDA. There have been 68 deaths overall, but only 37 of those are confirmed COVID deaths, so that accounts for about 6% of people supported by DDA who contracted COVID and had a confirmed COVID death. So as I said, in the month of January, we had 1 additional person who was in supported living, who contracted COVID. So our total in January was 32 people in supported living, 11 people in natural homes, 9 in ICFs, and 8 in residential habilitation. There was just one person in January who required inpatient treatment for COVID. I will say that the person that we added in the past week was diagnosed with COVID at a hospital, but they were hospitalized for other reasons. They were positive for COVID, but according to the hospital, asymptomatic for COVID, but were there for other reasons. So they don't count as requiring inpatient treatment. Overall, in this most recent wave, we had 8 people who required inpatient treatment, and of those, none are currently in the hospital. So as I said, of the people who've contracted COVID, we have had 68 who have subsequently died. 16 of those have been confirmed as not COVID related, and for 15, we are still awaiting the final cause of death, which then results in 37 deaths that have been confirmed as COVID deaths. The last confirmed COVID deaths that we had were in March of this year. Among provider staff, things also looked much better. In the past week, there were 3 additional reports of people with COVID, bringing the total up to 999, 61 staff who've been reported by more than one provider, and we've had 10 staff who have died from COVID-19. Unfortunately, that number has not been changed for quite some time. Amongst people supported by DDA, the vaccination rate, we're at 87%. As of this week, in host homes, 95%, in ICFs, 99%, in natural homes, 76%, residential habilitation, 98%, and supported living, 93%. Among our provider staff, it's at 96%, and with DDS staff, this is 95, it's actually 96% as well. So I believe I had spoken about this before, but the mayor did issue an order extending the public health emergency until February the 15th. She also extended the mask mandate until the end of February. During that public health, the most recent declaration of a public health emergency, she had allowed individual agency directors to expand telework temporarily within their agencies as long as we could continue providing services at the same level. And we did expand our telework. We, as people are aware, returned to virtual monitoring and visits with people. The flexibility to continue that ended today or ends today. And so our staff will be returning to in-person services starting next week, so that, whatever schedule staff had regarding days that they would be in the office will be their underlying schedule that was in place in December will be their schedule beginning next week. It also means for our RSA and DDA staff that they will be returning to work in the community with some caveats. For our DDA folks, in terms of visiting people in placements at their homes in the community, if prior to any visit, they will confirm that there aren't instances in that home, current cases of COVID, or that the home is not quarantined because of an exposure to COVID. If either of those are the case, they will do the visit either remotely or postpone the visit, but preferably remotely. Or if the provider agency has an approved contingency staffing plan or an approved crisis staffing plan because of COVID infections and staffing pressures in their agency, in those instances as well, we would not be visiting the homes, because if you're at a crisis or need for contingency level, you don't need additional people coming in from outside. When those are not the case, they will be resuming in-person visitation. And so people should be expecting that. Same is true for our RSA staff, in that we have RSA staff, people may be aware, who work at the American Job Centers, who work in our high schools, who work at different agencies that we have partnerships with. And we will be, in each of those cases, we will be checking in with the partner site and following whatever the guidance is at that partner site. So that, for example, some schools, even when they reopened in September, they reopened for the teaching staff and the students, but asked that other professionals not resume in-person meetings just yet. And then they resumed them a little bit later, and then they suspended them again. And so in every instance, we'll be working with whatever partner site it is. I see that someone is beginning to draft a question. It just says, what if the DDS? Oh, the number of people supported by DDA who have received their booster. Yeah, I think I can provide that. Yes. Give me just a moment, because when I share my screen, I make sure to close everything down so that I don't accidentally share the wrong information. So now that I've stopped sharing the screen, I can open things back up again. Our DDS, and I'll get back to the question about the number of people who've received a booster as I get that open, and are the DDS staff vaccinated and boosted that are going into residential settings? So the long answer to that question is one of the changes that the mayor implemented is that people may be aware that previously all district government employees were required to be fully vaccinated or test weekly, except that a person who had a medical or sincerely held religious belief that prevented them from being vaccinated could seek a waiver to that requirement. In that instance, those people would be required to test weekly. The ability to test weekly in lieu of a vaccine has been eliminated. And so beginning February 15th, all district employees are required to be fully vaccinated, including, when they are eligible, a booster. Now, when they are eligible may mean, if you had COVID a month ago, your doctor may say you're supposed to wait 90 days. I think that's the CDC guidance. So you're not yet eligible. Or if you just finished your complete vaccination series, the number of months hasn't run yet. So, we will be making sure that our staff are fully vaccinated. At the same time, there may be staff who have a medical reason that they cannot be vaccinated. Those people will continue to be required to test weekly. we would not disclose to someone that this person has a medical issue. And so there is the possibility that there would be a very small number of DDS staff who potentially had some medical reason that they could not be vaccinated. Um, and no, we wouldn't disclose that someone has a medical reason that they can't be vaccinated. So the kind of long answer is it possible? Yes, I guess it is possible that a person could show up at your home who has not been vaccinated. But you should also know that that person would have been testing regularly and that that person is provided with all of the appropriate personal protective equipment, and that you should make sure that you're protecting yourself and that we make sure that they're able to protect themselves. So to date, we have 979 people supported by DDA who have received a booster. Um, and let me just say, I've just pulled this up and I'm giving you that. And so next week, I'll make sure that that we've done a little more analysis of that data. The challenge with it, as I just said, is eligible for the booster. So, it varies according to a number of different factors. And so whether the person actually requires a booster is your first question, and then whether they've received it. And so, you know, knowing that 979 have received the booster, out of 2,027 who have received a vaccination, um, could concern people, but at the same time, you have to look at a lot of other information to understand that fully. So, and I will also say one of the things we've been making sure is that um, providers and DDA staff are uploading the booster information so that we're providing up-to-date information. But that's what we have so far. That's the number that's been reported. And as I said, next week, I'll make sure that we're a little more prepared to give a little more context to that number. What happens if a family of a person served in a natural home wants a virtual visit only? Then they would talk to the service coordinator, and the service coordinator would likely consult with their supervisor, and we would just make sure that, it's their home. So they may have limitations that they want to put in place, and at the same time, so we would just make sure that we're able to do the work that we're required to do, um, with the respect for it being their home, while at the same time making sure that we can complete any necessary um, monitoring of services, or making sure that they have the ability to receive the service remotely, etc. But any of those, they should just discuss it with their service coordinator. Can we share the link to the mayor's orders regarding boosters for DC employees? I guess so. Um, I will say all mayor's orders related to COVID, I believe, can be found on the coronavirus.dc.gov website. Oh, Yeah, the order that you posted says it right there, district government employee vaccination requirements. So what the order says is that the city administrator is directed to formulate a plan for removing at the earliest possible date the weekly test out. Um, and so the requirement that we have actually comes from the city administrator and DC HR advising all employees of the obligation to get vaccinated by February 15th. Just as a reminder, if people have questions, type them in the chat, and please do make sure that you address it to everyone, which is all the way down at the bottom. Is there update from DC Health on modified quarantine guidance for residential locations? Yes, and unfortunately, Nelson Vanucci, who joins us every other week, is not here this week. Um, as I always say, and I think he always does as well, please regularly look at coronavirus.dc.gov, and you will see that there were two issuances that were updated this past week related to uh, quarantine and returning to work. And those were updated, I think, January 31st and February 1st, if I'm not mistaken. I will give you the exact names of these issuances. We do have our folks from Candace and Andrew are both here from DC Health, and they may be able to respond to questions. This is really Nelson's expertise, and he is the one who he's the one who works within that unit that works on these policies, so he can probably give more detailed information. But the other folks here from DC Health will do their best to respond to any questions folks have. And so there is new health guidance that says guidance for people who test positive for COVID-19 and their household members, which does have some updates regarding isolation times for people. And I would encourage people to read it so that you can be familiar with it. And I see that a couple people have posted the new guidance here in the chat, so people who can see the chat can access it there. The other guidance that was updated was there we go. Healthcare personnel monitoring, restriction, and return to work was updated February 3rd. And I thought one more. I'm pretty sure there is one more. Hold on, and I will find the other one. Um, Sorry. Guidance for close contacts of a person confirmed to have COVID-19, quarantine and testing, which was updated February 1st. So they, as Nelson had said last week, they were working on a number of them. And so these three have been updated. I'd encourage people to read them. And Nelson should be joining us next week. You could ask him questions then, or Candace or Andrea will do their best to answer your questions now. And I'd also encourage people, even after you read them, keep them handy, because when you actually then come to a circumstance where you need to apply these rules, it really helps to read them over and make sure you're familiar with what they say, the distinction between, quarantining and isolation, exactly what isolation means, to make sure that we're not putting other people at risk, and and the periods of time, because those things are shifting, as people are aware. Um, but they require some monitoring and assessment in order to shift. Quarantine requirement has been lowered to 10 days, it says, but still risks damaging people's employment, community inclusion, and just to what I infer from the statement, to explain to the DC health folks, is that this is an issue of, it's a 10-day quarantine requirement for people who live in supported employment, or supported living, I'm sorry, who have stricter quarantine requirements than you or I would have, who are not in supported living. Where if I had a direct contact exposure with someone, was fully vaccinated, had no symptoms, was monitoring my symptoms, and tested after 5 days, I could be going to work. Whereas, according to this guidance, people in supported living cannot. I think that's the. I think I'm not improperly inferring too much from your question, correct, Carol?
Oh, good afternoon. This is Candace Johnson from DC Health. I was I don't know how to clearly explain why that decision was made on behalf of the guidance and DC Health leadership. I can take that back to Nelson and his guidance team and determine whether or not there was clear indication of why the supported living uh, individuals were looped in with healthcare facilities, and we can provide that information at the next call.
Thank you. And I don't think I was limiting your description too much, Carol, was I? Because the same could be said of people in ICFs and ResHabs, but I think that the explanation there is different. Correct. DC Health does have a more direct oversight of licensed facilities. Not yeah, absolutely. Has in fact oversight of licensed facilities as opposed to supported living placements. And one piece of the guidance, which I had not really noticed before, it also says other congregate settings, including homeless shelters, where a person's exposed to COVID-19, must also adhere to 10 days of quarantine. Um, and so it does seem that the focus is on sort of the congregate nature of settings, which could be part of what would be helpful to have the discussion with DC Health about, given that we have a number of people in supported living who, I mean, for one, it's rare that there's more than two people. There could be three people in supported living. We have a number of people where it's a single occupancy supported living. So it's not what I would consider congregate living. But as Candace said, she'll bring that back to DC Health and they can consider this input. So I would encourage people to, as I always say, consult regularly with the coronavirus.dc.gov website, not only so that you can stay up to date with their um, health guidance that's issued on that page, but also the data that's shared every day. Um, you know, while the middle of December to the beginning of January was really rough in terms of the COVID numbers in the district and for DDA and our provider community, um, we have seen that number come down sharply. A month ago, it was at 325 per 100,000 per day. And as of a week ago, it was down to 35. Last summer, it was below 5. In Before the most recent um, Omicron surge, it was below 15. So, hopefully we will see it come down. The other things you can find on that website are the locations for folks that live in DC, the locations of COVID centers in DC. There's one in every ward. I'm not sure if the Ward 3 one is open yet, but there's one in every ward. They're open 6 days a week. You can go in there and get KN95 masks. You can get COVID tests. COVID tests are widely available in the district. You can get information on coronavirus.dc.gov about vaccination and boosters. While our numbers are looking better, we still have a little ways to go. So we'd like to see everyone vaccinated and boosted. And all the resources that you need in order for us to make that happen can be found on that website. And to make sure that we all stay healthy as we move toward that goal. So if there are no other questions, it's quarter of. Have a great weekend, everyone. And as I said, I'm pretty sure that Nelson will be joining us next week. So he should be able to respond to questions that people have. There were these 3 new guidance issued just in the last week, so people can read those through. As always, we do send out a request for questions. So if people have more detailed questions, if you can submit them by Wednesday, we also have an opportunity at least to try and direct them to the right place and have more thorough responses for you. So have a great weekend, everyone, and we will talk again next week.